So the NCCN, or National Comprehensive Cancer Network, publishes guidelines through the MPN panel on both MPNs and systemic mastocytosis, as well as myeloid and lymphoid neoplasia with recurrent gene translocations, gene alterations. So there's three main guidelines that come out from this panel. We recently updated the systemic mastocytosis guidelines, really kind of focusing on honing in our recommendations for making the diagnosis and recognizing the consequences of the disease, but also refining how we use KIT inhibition to treat systemic mastocytosis. So KIT inhibition has become centerfold for treating systemic mastocytosis, both with the advent of midostaurin as well as other more specific KIT inhibitors. So really, we have to make sure we're keeping up to date with the latest data as these KIT inhibitors are moving from later stages of disease into more earlier stages of disease as that data evolves and emerges. And the field is moving at such a breakneck pace with newer KIT inhibitors being developed and potentially with potential approval that, it's a good thing that the guidelines are nimble and quick and have the opportunity to be updated in real time almost throughout the course of the year. So I think that is a major advantage of the NCCN guidelines. So my advice to those out in everyday practice is not just to download it once a year or once every couple of years, but like if you have a patient with mastocytosis in front of you, it's good to kind of get a fresh set of guidelines because we do update them quite often.